Okay. Well, let me start by just thanking you all for having me. I am at CLASP, Center for Law and Social Policy. We're an advocacy group here in DC that works on a range of programs and policies that affect low-income individuals and families. And I've worked on TANF and income supports for a pretty long time, and this is actually the first time I've been asked to focus on young adults. So actually I learned something presenting. I didn't have a canned presentation to pull, but I also think it says something about sort of the outlook of these programs, that breaking it out by young adults is just not something that's done very often, if at all. So these programs are focused primarily on poverty and income, and many young adults are poor. The official poverty rate for adults 18 to 24 is just over 20%, and we know that would be a lot higher if all the individuals who either are living with roommates or with their parents were separate households and were being counted based on their own income. So why are a lot of young adults poor? Two reasons. One is less likely to be employed, and the other is that they have lower earnings even when they are employed. So I assume you've probably seen versions of these charts for the past 2 days, so I won't spend a whole lot of time on them. But there have been, large declines in the share of young adults who are employed in recent years. And that's going to different places. In general, we know more young adults are in school now than they used to be, and that's generally considered a good thing. But when you've got young adults who aren't in school and also aren't working, that's highly problematic. And of course, even if they are in school, the lack of income may be a big challenge. So I think people think we've got a more robust safety net in this country than perhaps we actually do. And the safety net really varies by your family status. In particular, do you have children? Are you yourself a parent? The safety net for parents is not perfect, and I will get into that, but parents are eligible for cash assistance under TANF, temporary assistance for needy families. That's the program that used to be AFDC, sometimes called welfare. SNAP or food stamps are available. Medicaid is more available to parents than to non-parents. That will change next year, at least in those states that adopt the expansion. And the earned income tax credit is a much, much larger subsidy for low-wage work for people who have children than for people who don't. If you don't have a child, if you're not a parent, you can't get cash assistance under TANF. You get a very small earned income tax credit. And in fact, this population, the under 25, are not eligible for the earned income tax credit for childless workers at all. Currently, basically, if you don't have kids, you're not eligible for Medicaid, except in 1 or 2 states that have expanded on their own. And there is a limitation even on SNAP, which is the most widely available benefit, food stamps. Able-bodied adults without children are limited to 3 months of receipt in a 36-month period unless they're working. That has been suspended in most states during the recession, but those rules are coming back as the unemployment rate drops. In addition, basically full-time college students are not eligible for food stamps. There's an assumption that they're not really poor unless they have young children. So it's a very mixed benefit with very different results. About 40% of poor young adults do receive food stamps, even for that most widely available benefit. It's about less than half. For welfare, the ACS doesn't actually break out TANF on its own, so this is TANF or SSI, and it's only about 4% of poor young adults receive benefits. So thinking about this flip, though, if you think about, well, how many people are being reached? And it is, in fact, these are larger programs than foster care, for example. TANF, it's interesting because the data breaks it out differently depending on whether you're looking at the adults, which really means parents, because teen parents are basically considered adults. I'll get into more detail. So it's about 300,000 children getting cash assistance in the 16 to 19 age, 86,000 teen parents, and a bit over 500,000 parents in their 20s. As you all probably know, teen parenting has actually been on the decline for pretty much the past decade, but there's still lots of people having children in their 20s. One thing to highlight there is when you think about why so many young kids are poor, a lot of it is because their parents are young adults. The young adults who are receiving TANF who are poor, they don't have teenagers themselves, they have infants. SNAP served over 6 million young adults, ages 18 to 25 in 2011. It is a much bigger program than TANF in general. It's not limited to parents. It has much higher income limits. Focusing specifically on TANF because it provides, in addition to cash assistance, a set of services that are designed to connect people to the workforce and has the potential to provide a much richer set of services, although work is certainly the emphasis. And it's striking because it's really not talked about at all, but more than half of TANF adults are in their teens or 20s. I had actually not seen this data before I got ready to do this presentation, so I thought this was really interesting. So TANF has a lot of rules. Teen parents, minor teens, are required to live in an adult supervised setting, either with their parents or in another setting that the agency approves, and attend school in order to get assistance. There are some special rules for teen parents to let them be counted based on attending school or participating in education directly related to employment. And one thing that's interesting is these rules actually say teen parents, so it's not limited to minor parents. But if you look at the actual participation rate data, states are clearly interpreting this as only applying to minor parents. The 18 and 19-year-olds are much less likely to be in high school and much more likely to be treated like adults. And for adults, education is really not the emphasis under TANF. This was one of the things that happened in welfare reform in 1996. Adults are required to average 30 hours per week of work participation. That drops to 20 hours per week if they're single parent of a child under 6, as most of the young adult parents would be. But full-time education is basically limited to this vocational education training category, which is limited to 12 months in a lifetime. And there's also a 30% cap on how many people can be claimed under that, but most states actually aren't even running into the cap. Other than that, education is only counted towards the work participation rate when it's combined with 20 hours per week of a core activity. Except that, remember, if you've got a young kid, you're only required to do 20 hours per week. So there's basically no credit for doing anything other than the core activity. This is work first. This is sort of the model that was adopted as part of welfare reform. So I think sort of putting those two bits together really raises some interesting questions when you think about everything else I think you've talked about over the past few days, about young adults' developmental needs, about the increased education, both how that it takes longer for youth and young adults to complete their education, and also, obviously, the need for education in order to get good jobs in society. So it really does make you think that if you thought of this as a program that was primarily serving youth rather than as the program that it is, the program design might look quite different than it currently does. The other thing I'd flag is that in general, in most places, there's a welfare program over here, and there's a set of programs serving youth over here, and they really do not talk to each other, even though individuals might participate in both programs and certainly might be eligible to participate in both programs, but they tend to operate in very different worlds. Some of this is, again, this very different focus that TANF is very focused on immediate work, whereas youth programs tend to be more developmentally oriented, more voluntary, setting goals that youth have determined for themselves. Some of it also has to do with how the programs are funded, that TANF is operated at the state level. WIA funds localities directly, the Workforce Investment Act, so they don't necessarily administratively click together very well. The other point I'd flag is, again, this bit about the earned income tax credit for childless adults not being available to youth under age 25. This was clearly designed because they didn't want students working part-time who were primarily being supported by their parents to be eligible for the EITC, but that's not the reality of who it's excluding. And obviously, given the low labor force participation rates for many young adults, this is precisely the group that you'd like to see have more work incentives, particularly. Okay, sorry. This is, without getting into a lot of details, this is a pathway map that my colleagues who do focus more on youth programs have developed, really showing multiple entry points, multiple exit points, really sort of meeting people where they are, providing them with the skills and supports that they need to succeed. And that's frankly just not the model that is the place in most TANF agencies at the time. SNAP, food stamps, does have a small level of funding for employment and training services. Those are, except in a few cases where they are being used to support richer educational pathways, mostly being used to help people in that able-bodied adults without dependents package meet the work requirements so that they don't lose their benefits. And obviously it's important to have that available so that people can access the nutritional supports that they need, but that program can also be a much richer support. So before I conclude, I guess I'd just say, TANF and SNAP really do focus based on poverty rather than other risk factors. I think before we were hearing more about some of the emotional and social developmental needs. And I guess I'd say the thing to think about for when you think about the poverty population more broadly is that it is really diverse in these other risk factors. There are people in this population who really what they need is money, and they don't have any other crises going on in their lives, that they need jobs that pay enough in order to be able to support themselves and their families. Or they have jobs, but they don't pay enough. There are other people who really do have all these different things going on in their lives. Mental health issues, substance abuse. We know some live in these, very high crime, high violence communities where, perhaps some of the lessons from the returning soldiers might be more applicable. So it's even within TANF, which is just for very poor low-income parents, it's still heterogeneous. And how do we think about that going forward?